Welcome to the Chaos Whispers of Healthcare, the podcast for busy healthcare leaders who are ready to get out of survival mode so they can focus on what matters most. This is where the burnout stops and the real talk starts. I'm your host, Dr. Megan Carter, and each week I sit down with healthcare innovators who get it. We will unpack the chaos, laugh through the hard stuff, and get you at least 2 practical tips you can use at work right away. If you're ready to clear the chaos and lead with impact, you've come to the right place. Let's jump in. Welcome to our very first full episode of the Chaos Whispers of Healthcare podcast. My first guest today happens to be a very longtime friend and colleague who I had the pleasure of meeting back in 2014. It's been 11 years, friend, at Baylor Scott and White. So I was a nurse manager looking to help my nurses deal with absolute chaos. And I didn't know where to start. And today's guest was working in corporate as a human factors engineer. And I reached out to him to help me get my nurses out of survival mode and get more time in direct patient care through some time motion observations. We rolled out this nursing workload project together and ended up removing over 2 hours of interruptions and noise. So those 2 hours of waste allowed them more direct patient care time, and it was all thanks to his human factors expertise. Now, you might be wondering, what on earth is a human factors engineer, and what does that have to do with me as a busy healthcare leader? Fear not, listeners. This guest has a great deal of experience in healthcare and will have so many incredible practical tips and tricks to help you as a busy healthcare leader clear the chaos and lead with impact. I am so proud and excited to have this conversation today. Without further ado, welcome Dr. Adam Probst.
Thank you, Megan. I appreciate it so much. Yeah. You're one of my favorite stories in healthcare that I tell people on how human factors can help. Yep.
Same.
Thank you for having me.
Absolutely. I feel like we should have like applause or some kind of like siren going off right now, like ta-da.
Yeah.
I'll add that in. I'll edit that in, friends. Okay. Awesome. I love it. So excited to have you here. Adam, you recently joined the Carilion Clinic, which for those who don't know, the Carilion Clinic is like the legendary institution that has fully embraced human factors and healthcare partnerships. So you just started here as the Director of Human Factors Implementation. And you shared with me that while you grew up in a healthcare family, you actually fell into human factors following an elective course in college. So tell us a little bit more about that career path and briefly how human factors engineers partner with healthcare leaders and clinicians.
No, happy to. So my dad was what we now call PCPs back when they owned their own practices. They no longer do. But so I thought that's what I wanted to do. And then went into, started at Texas Tech with biology major, going through all the prerequisites, doing all the stuff that you have to do. But then I took, because I was College of Arts and Sciences.
Yeah.
We, so many electives you had to take in different areas and all of that. So I was like, I don't know what human factors is. I've never heard of it before. Most people probably haven't. But I took a random class, kind of a research methodology, human factors type class, joined, really, really loved it. The professor there, Keith Jones, he's the now department chair of the human factors program at Texas Tech, but he was the teacher of that class as a associate professor way back then. Was like, this is kind of neat. I would like to learn more about it. He's, well, why don't you join? I always need undergrad research assistants. Why don't you join and do that? And so I did. And then about a year later, switched my major from biology over into the human factors program, the cognitive engineering program there. And then ironically enough, loved it, finished, went to grad school in Kansas for 5 years. But the best part of the story to me is that at the time it was the legacy Baylor healthcare system before they merged with Scott and White.
Yeah, the blue flame.
Yep, the blue flame. Yeah, and they and so he actually, he knew I was working my dissertation trying to get finished, sent me a job posting for human factors in healthcare. I never gave up the love of healthcare, but at the time there was no human factors in healthcare. Now it's more common. Back then it was like you're either doing research or you're doing usability informatics type work.
Right.
And so he actually's like, hey, you may be interested in this. Now, do you want to get back to Texas? What do you think about, this job? And I applied, ended up getting it, and then it reshaped my entire career. So the guy that brought me into it through a random class also sent me the job posting that started my career, like in patient safety, quality, and applying human factors. He and I still text weekly to each other. He asks me questions. I've helped out his students. He's helped out some stuff I'm doing. And so it's been, it's weird how life works sometimes.
It's amazing how one connection or even one email or text can change your entire life.
Yeah.
Like, that's just wild to me. I love that. Thank you for sharing that story. So, this podcast is all about chaos whispering. So I like to start by asking the guests, tell me about your most chaotic leadership moment in healthcare. Not that there's, many, but tell us your most chaotic moment in healthcare.
Yeah, I think it was at my previous stop in the organization I was with prior to joining Carillion. When I got there, they had bought themselves out from HCA. And so they lost all of that infrastructure, all that support, all of that, because HCA is very regimented in how they kind of approach, delivery of care. And so they lost all that and they were trying to figure it out for themselves. And then they merged with an academic or with the health science centers of the university and became an academic medical center, which is wonderful. But my team used to be risk when I joined. I wanted to take us pure patient safety and quality. And they agreed with that. But I was dealing with a team that was hired for an entirely different purpose than what they were being asked to do. And it's like, well, here's the training you're going to get on how to do RCAs, on how to do patient safety work, on how to, all the stuff that comes along with that type of organization. And some dug it, some didn't. Partly during this, so there was a lot of turnover. They gave it 6 months to a year. Some were like, I was hired as a risk manager and now I'm asked to do patient safety stuff. I'm not really sure what I'm supposed to be doing or if this really fits me. And so some began like, I'm going to go back to education or I'm going to go back to informatics or, wherever it was they came from. So the chaotic piece was trying to manage a team, like moving to a new city, starting a new job, managing a new team that was hired for entirely different purposes than they were being asked to do, trying to train them, build new templates for how the new process should look in my mind. And then unfortunately even had, one of our team members pass away from cancer at the same. So I'm constantly trying to rebuild this team with people that I needed that could do that patient safety type work. But that was the hardest part by far, was just the churn. And then we just had people that were like, hey, we've had 4 different leaders in 2 years because somebody was temporary, somebody was interim, and then I got there, and that sort of thing. And so that was the hardest part, was trying to figure out how do I pull this team together. They were hired for different jobs and they're being asked to do people are expiring, unfortunately, and I'm having to replace. And the constant churn and burn where people just got really tired of, okay, it's changing. Okay, now it's changing again. Okay, now it's changing a third time. Now you're our 4th leader. And so that was by far the most chaotic piece, and trying to navigate that, which I had no experience in doing when I got there.
Yeah. And it's interesting. First of all, I'm so sad to hear that your employee passed away. That's tragic. And unfortunately, life happens to all of us. And between that, and it sounds like a lot of change fatigue, maybe in the team that you inherited. I'm sure there are a lot of listeners who have walked in as a leader new to an organization or a department and have inherited, the good, the bad, and everything in between that comes with it. And it's hard in those first 90 days. So I think it'd be interesting for the listeners if we could explore a little bit more what it was like for you to move from a corporate role as the human factors engineer at one health system into an actual operational hospital leadership role. So specifically that first 90 days, what surprised you the most? You've been helping these leaders in your corporate role for years, and now you're walking in their shoes. What surprised you the most about life as an operational healthcare leader?
Yeah, I love that question. I think it's a great one. One of the best way I can describe it is it felt like getting hit in the face with a bat, a gigantic bat that had minutia engraved into it. I was not used to that. Yeah, like
Yeah.
it was. I walked in and I'd worked on local projects, facility projects, regional and enterprise projects prior to coming here, so I'm used to rolling out new things. But I walked in and I was like, okay, well, you used to be risk. I was like, okay, we're not anymore. We're patient safety. Learn all this other stuff that I've never had to deal with before. And it was like getting hit, like it was walking into the buzzsaw that just says, do all this. So I was now in charge of, uh, you know, like payment reductions and complaints and grievances and regulatory and all of these things that I was like, I just want to do what I'm good at. Like, I just want to go help people, and help the nurses and the staff and the techs and PTOT and ancillary and whomever, to do what they're trained to do and get and have time in which to do it. Number one, but I'm sitting on meeting from meeting to meeting. I went from working relatively busy hours, like maybe 40 to 50 hours. I mean, 50 hours a week typically. I mean, but that's not really all that busy, in the corporate world, to 80, 90-hour weeks.
Mhm.
And it was because I was trying to deal with all of the administrative pieces, and now I own this, and now I have to figure out, is this a service recovery thing, or do I write off this bill? And things that I had no experience doing, that I had no idea were part of the job. And so we had a program called Central Teams, which is a great example of this, I believe, where we met once a week. It was finance, it was patient experience, which my team used to control when I was there. Luckily, they no longer did. That was one of the things I got rid of. But then is this a quality of care concern? Is this a spay? Is this a whatever? And I was like, I don't know how to do this. Like, I don't know no one told me I would be doing this stuff. And then when I got there as well, it was like, oh, well, you also own the rollout of a brand new event reporting system, which I have never brought one live before. I had no idea what to do. It was just things that it was the minutia of trying to navigate the system that became so hard. And I just became chained to my desk when I needed to be out on the units and looking at the work and talking to my staff. I was like, we had our team huddle, and we were in a square foot area of maybe, I don't know, I mean, I'll make it up, but say like 3,000 square foot. I mean, everybody had their own office, but we were all in the same area. Uh, and we would meet on teams because everybody was too busy to even like walk to the conference room. And so that part was, for me, the biggest, like, whoa, this is way different. Taking over a team that is not designed to do this, is trying to implement new processes, and all I can do is go from meeting to meeting to meeting.
I
And so
think
it was
I,
exhausting.
I didn't mean to interrupt, but I think I love that you shared that. And thank you for being transparent, because I have yet to meet a healthcare leader in my 20 years that could not empathize with what you just described. And it's not a criticism of the organizations themselves. It's not their fault, honestly. It's not
Right.
intentional. None of these executives or these board folks wake up and want it to be this way. What we're facing and seeing is the result of years and years and years of crisis, dwindling financial resources, having to go through reductions in force at both at the leadership level and the front line. And what happens is, between mergers and all this, you have people who are thrown into these roles who have the best of intentions. I heard you say, I wanted to be with my people. I wanted to help the clinicians. Every healthcare leader is nodding their head right now. That's all I want to do. I want to help make the world a better place. Let them do the sacred work of healing. And yet, when we get to work, it's meetings, interruptions, crises, projects, and there's typically minimal, if any, onboarding. We go from
Mhm.
being a clinician to a leader, or to your point, from your perspective, corporate to operational leadership. And even the best intended, onboarding can't prepare you for the challenges. And it's not all bad. We're not here to just talk about what's bad, but it's acknowledging the trauma and the reality of being asked to do so much with so little. And you do that for years. And it's no wonder folks today in healthcare are just trying to keep their head above water. I remember seeing your
Mhm.
calendar one time, trying to find a space to meet with you. And you weren't just triple booked, friend. You were like quadruple booked from
Yeah.
like 6 a.m. to 9 p.m. And so what do we do about that? Right. So we know that with all those pain points that today's healthcare leaders face, let's talk about specifically organizations' resistance to working smarter instead of harder. And what I mean by that is we know that meeting madness, those triple book calendars, being in constant crisis mode is not ideal. And many leaders, especially in those first 90 days at an organization, have this incredible gift of being able to spot those barriers and those inefficiencies, right? You come in, you have no bias, all you're noticing is what's different. When they bring up those barriers and maybe even try to make it better, like I know I would say, hey, here's what we did at my previous organization. If you're interested, it just works a lot
Mhm.
easier. They'll often hear the more seasoned leaders there say, but we've always done it this way. It's like our favorite catchphrase in healthcare. We've always done it this way. If we're all being honest with ourselves, we know that over time we start to accept that response because, as you described, sheer exhaustion, right? The thought of trying to constantly innovate can feel like this uphill battle that we just don't have time or energy for. And yet, that first 90-day mindset is so powerful because you can quickly see low hanging fruit that would make your life so much easier. So, from your perspective, having done this, how can busy healthcare leaders keep that first 90-day mindset, and how can that help them streamline their day-to-day work?
No, I love that question. Yes. Yeah, no, and you're exactly right. It's like, well, we've always met once a week. Why? Why? Uh, I don't know. That's who sent the original schedule. That's how they set it. So we've
Mm-hmm.
done it for 3 years. I'm like, we don't need to meet weekly. We can, do this remotely. Yeah. And so, one of the things I did, I approach things a little bit differently because I'm human factors, right? So, which is kind of that ergonomics from the neck up type approach. And so I've always kind of had that in the back of my mind, like, why are we doing this? One of the things that I did that really helped me that I set up when I started, part of it was to learn
Mm-hmm.
because I was new to the system. I was trying to learn the team, trying to learn, hey, what are the expectations and asks and deliverables that we're supposed to provide to whom, those types of things. But I set up a weekly, and I would buy lunch for the team. Which is either reasonable or not. My team was relatively small; it was like 9 people, but I would call them the gross meetings, the get rid of stupid stuff meetings. And I would buy lunch and I would say, okay, guys, what are we doing that you're spending time on that you just present at a committee or a council and people go, okay, but it leads to nothing. Like there's no interaction. People are just like, okay, yeah, we're supposed to have patient safety or whatever present. Here's our data. Okay, I can give you a dashboard of data. Like, why do I need to have a meeting about it? And so that was one of the things. One of the things my team did when I got there that I immediately stopped was they used a different event reporting system prior to the one that I rolled out, but they daily would go through and look at, okay, over the past 24 hours, what are all these patient safety events reported through the event reporting system? Great, good practice, best practice should be done. They would then take that, export it to Excel, reformat it, color code it, and then why I don't know, to give the leaders an idea of, okay, red's like a sentinel event, maybe yellow. We let the unit manager know. Green, we just assigned it to someone, or I mean whatever their system was. And I was like, why are we doing this? I was like, make like build the dashboards and the data and the summaries in which people can go look at in their own time. Why are we spending 2 hours going through every event and then 1 hour reformatting how we present the data that's already existing when we can just build a dashboard and have people just go, okay, I'm the manager of 6 West, or I mean, whatever. and go in and just kind of do that. And so we would have bi-monthly gross meetings, as I call them. And so and then basically what we would do is I was like, all right, I want you to come prepared with a list of, this doesn't make sense. This is a waste of time. And then what that made me do as a leader, though, was know that, okay, well, this meeting's coming. I have to have stuff on my list as well. Like, I can't just go there and go, okay, guys, what do you think?
Right.
I had, so whenever I encountered, why is it taking so long to do X, Y, Z, or why is this so complicated? It forced me to keep a list as well that I could then ask with my team and say, okay, how much do we do this, or how much are we doing these types of projects or approaches or task requests or event review requests or whatever it was. And so that kept me accountable to them, and then they knew that they were accountable to me to be like, yeah, this is dumb. Why are we doing this? And so that was one of the best ways I was able to keep that mentality moving forward, because it became a standing agenda item that they knew they were getting lunch. They knew that, we're going to talk about stuff that makes their lives easier, and we're going to try to standardize among the entire office. And so that's one of the approaches I took.
That is so brilliant. And I love that it's an acronym,
Yeah.
growth, while you guys are eating, which is
Yeah.
fabulous because most healthcare people can sit and eat. We pride ourselves on being able to eat while we talk about really gross stuff. So that's practical tip number one, listeners. Gross. Get rid of stupid stuff. Make that a
Yeah.
standing agenda item, practice, whatever, to maintain that first 90-day mindset. That's brilliant. That's awesome. Thank you for sharing that. I know we
Absolutely.
also talked about previously, as you were switching from a corporate to an operational leadership role, you have to take on having accountability conversations, which is different, being in corporate and helping people and supporting versus actually having to own the outcomes themselves and manage the people themselves. And so I think you've mentioned before, maybe the first time you had to put an employee on a performance improvement plan, which just saying PIP or performance, everybody's sweating because, it's part of what we have to do. Most of us view accountability conversations as deeply uncomfortable. We know they're necessary, but they're not comfortable. We don't like having to have them. It takes so much practice and skill to do it well. I like to call it compassionate accountability because it's important to me that I keep the other person whole throughout the conversation.
Mhm.
But what practical tips could you share with our leaders around how to have those difficult accountability conversations?
Yeah. So this is where my West Texan will bleed through, that kind of mentality. Uh, you know, the best advice I could give, because I was there a month. I didn't know my team yet, barely. I mean, I knew their names, and I knew kind of what they did, and but I didn't know them individually. It was like, well, so and so needs a level 1 PIP because stuff that happened before you got here, and I was like, okay, I don't know why am I even involved in this? I've never gotten a PIP. I've never given one before. Prior to this, prior organization really, really liked them for some reason. Uh, where I was prior to that, I don't think I knew of any that I was aware of. So the culture was very, very, very different, going from where I was to, where I went prior to Carillion. And so my main thing was I started it off. It was like unfortunately ended up being on a Friday, which I don't recommend. I think that was it, but it was really, I'd been there a month and it was right before Christmas. And so it was like the last day to try to do it. And so that part made it feel like I was trying to cop out, like by doing it on a Friday. I really wasn't. It was just the only time that was available. But the West Texan in me came out and it was more kind of yeah, I haven't seen this yet. I've been here a month. I don't know you well. Uh, and then trying to really dig into what would I want to hear, and I'm like, this is a person, and they're trying.
Mm-hmm.
Right. I mean, there's something different between kind of, okay, hey, we might want to change the verbiage of your emails and the tone in which you're having meetings versus an egregious breach of
Sure.
practice, right? So those are different. Hers was more on the prior side, and so it was more of a, hey, maybe we could conduct more professionally, maybe we could do all this kind of stuff. And so I started out by basically saying that I know I'm new here. I'm still learning everybody. I appreciate everything you bring to the team. And I'm not trying to like do the sandwich approach or any of that other kind of stuff. I don't think I find that completely, just artificial
Hmm.
and everything else. And so I was like, I more just wanted to connect with her as a person. And I was like, okay, I have noted now. Here's are the things that I've noticed in which I think we could have reworded this better or been less blunt, or there's an old transplant nurse, and so they're very kind of like that's why nurses are my favorite people to work with. But they I was really big on saying, okay, trying to give bad news gently. I have a twin sister that's in the high upper echelons of Target, and so I asked her, I was like, I don't know, I've never done this. I don't know what to do. I've looked online. I've read scripts. I don't know. I've never had to do this before, and I'm just being asked to do so. And so she described it to me as approach the conversation as if you were watching like a buddy's dog over the weekend and they got out of the backyard and you lost them. Like it's like this is
Interesting.
gentle, yeah, like this is gentle, like gentle bad news, I guess, is the best way. She was, in terms of, okay, I take responsibility for this, or here's what we need to talk about because this is
Yeah.
what actually is happening. But I'm, like I want to respect you as a person and what you're doing and how you're approaching this. And so I was like, okay, so that helped quite a bit. I listed, the opportunities she had specific to the corporate quote unquote values. Every organization has pillars or values or cornerstones or blah 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 or
Yep.
whatever else. And so I was, here's where I think, that this ties into the new corporate structure and the new values and everything else going on with that. Um, and then more detailed in the feedback, like, okay, here's an example, or here's how I would have worded it. Not everyone. I didn't want to like club over the head with 30 examples or 20 examples or whatever. It was just more like here's a couple, and here's what I would have done otherwise. And then it was more, hey, no, I'm 100% open door policy. I would like to talk to you about this. Chew on it for a while. Let me know what you think. And then, but here's what the change needs to be. And so from then on, it was phenomenal. She immediately reacted to it. It was great. But it was one of those where I was like, I don't know this person.
Hmm.
And barely.
Yeah.
Um, and it's like, go do it. I was like, well, okay,
Yeah.
I can, I guess.
Yeah.
And so she was wonderful about it, but it did. I will be honest, it stuck in her craw so much
Mm.
so that she was one of the ones to lead the team
Mm.
because of that.
Yeah.
And so it was something that was outside of my control that I was just like,
Sure.
oh, yeah.
Yeah.
But it was really just kind of trying to reflect as a and then ending it with not with the sandwich approach, but more so like, no, here's what I love about what that particular instance was that spurred the actual PIP. Uh, Here's what I love about your personality that supports everything else. Just try to funnel it in a different way.
Yeah. Yeah. I love that you shared that. Thank you for sharing that. I think I heard so many practical tips in there. So I heard number one, you acknowledged maybe that there was an opportunity for you to get some experience. There was a knowledge gap, experience gap, which is common for all of us as leaders, whether you've done it in general before or even had that conversation with that person. You could be in a place for years. If you've got 800 employees, you're not going to know everybody personally, right?
Yep.
So you recognize that. So that's number one. Recognize where you are in your relationship with this person. Two, I heard you reach out to someone who has experience and you guys practiced and role played a little bit. It sounds like you took the time ahead of the conversation to make sure that you were going to keep her whole. And
Yes.
then I heard you specify the behaviors themselves. Like you came in and said, this is not about you as a human being. This is about the behaviors themselves. And we're here to talk about it. So that's number three. And then I heard you tie the behaviors to the corporate values. You connected the dots.
Yes.
You got their feedback as well. It wasn't a one-way conversation, it was a two-way dialogue. And instead of following a pre-prescribed method like sandwich method or what have you, you decided to go with your gut, see how they responded, and you closed it with, here's what I love about your personality. Here's what I appreciate. And moving forward, specifically, here's the behavior we need to see change.
Mhm.
You just
Yeah.
spelled out your own accountability framework, literally, with that whole. So
Oh,
that was fantastic. I don't know if you knew that, but you have an accountability framework.
that's yeah. No, I didn't. Yeah, that's why I love the way your brain works. Yeah,
That's
I didn't
great.
know that. Yeah, yeah,
Yeah, look
it's
at
just the way that
you.
made sense to me. So,
That's great. That's what chaos whispering is. Like I have this term and we kind of giggle about it, but that taking a really complex situation or environment, figuring out what matters quickly, and then focusing on that. But at the end of the day, it's about keeping people whole. I don't care if it's a
mhm.
patient in the bed, an employee, a peer. We're trying to keep people whole because this healthcare system is all about easing human suffering, not just for the patients, but for us too, as the people working in this very broken system. So I love that you had that example. I'm so glad we brought that up. So much incredible insight being shared today. I know that this is going to help our listeners address the challenges of resistance to change and accountability. I like to close by asking the guests something fun, like where do you go to find joy or humor in your life? And I ask because I love sharing this with the listeners. So I've known Adam a long time, and he and his wife, Kim, gifted me and my husband years ago a hilarious movie, and it was Tucker and Dale versus Evil.
Best
And I
movie ever made.
love it is such a ridiculous. If you've not seen it, listeners, I'm telling you, go watch this. You're going to laugh so hard. My son cried. He laughed so hard. It is ridiculous. It's humor. It's joy. It's a perfect antidote to a stressful week or stressful job. It speaks volumes about our specific senses of humor, Adam.
Yeah, that's why
What
I
are
knew you'd
you?
love it.
I love it. What are you watching or listening to these days to keep the laughter in your life?
The laughter in my life. Oh, I will say I've been loving the pit, but not because of laughter. Honestly, Righteous Gemstones. I've, I've, like Judy is the best character on that show, and
She is
Uncle Baby Billy.
hilarious.
Yeah,
Yeah.
and Uncle Baby Billy are by far the best characters. But yeah, that's probably my go-to comedy. I know I'm sad this season just ended, but yeah, that's probably my
So
go-to.
funny. Danny McBride is brilliant. I mean, he has been
I don't know how he does
he
it.
has a very specific style of content and he's consistent with it all the way
Yeah,
through. So yeah,
totally.
y'all. So now we've given you some really highly intellectual content. Tucker and Dale versus Evil
And Righteous
and
Gemstones.
Righteous Gemstones. We watched that. My husband loves it. He's seen all the seasons. I'm still catching up, but it
Oh,
absolutely cracks me up. I mean, it's a great
it's
way
so
to escape, yeah,
it's,
seriousness.
it's amazing. Yeah, that's my guy. I'm rewatching season 3 now. Yeah, and so it's
Love it.
Uncle Baby Billy is my favorite character. Judy and Uncle Baby Billy. Yeah, by far.
I my first exposure to it, my husband Bo was watching it. He was on, I guess it was season 3, and I happened to walk into the living room, and it was right in that scene of Baby Billy's Bible Bonkers. Is that his game show?
Yeah, his
So
game
that's
show.
my first impression, and there's so much going on. It was stimulus overload for me. I mean, between the
It's a lot.
pageantry and the Southern drawl and the kind of the Pentecostal extremism, like there's so much happening. I was like, I need to dig into this and I need to follow these characters on their journey before I
Yeah,
just jump in.
him playing Tingus. Yeah, is yeah. It's amazing. It's one of my favorite things.
Fantastic. I love it. I love it. Awesome. Well, Adam, thank you so much, friend, for taking the time to share your insights with us today. For the listeners, your key takeaways are going to be shared in the show notes. But as a reminder, first 90-day mindset is that acronym GROSS. Get rid of stupid stuff. I love that. I'm going to start using that now immediately. And then we'll talk about the accountability framework that Adam mentioned there to have that conversation. You're amazing. Thank you so much, Adam. If our listeners want to find you, how can they connect with you? How can they find you?
Yeah, I'm on LinkedIn.
Okay.
Um, that's I'm a middle-aged white guy. Yeah, I don't have a lot of. I don't have
You're not
social
on
media stuff.
TikTok
Yeah,
and Instagram and who knows,
yeah.
Snapchat. Yeah.
Yeah, I don't know how those work. Yeah, but no, LinkedIn. You just Adam Probst,
Perfect.
Probst. Yeah,
Yeah. Well,
or just like yeah.
yeah, we'll put Adam's contact information in the show notes. You guys find him on LinkedIn, connect with him, follow him. He's about to do incredible things with the incredible team at Carillion Clinic. More to come on partnerships and things we're trying to do for these precious clinicians. But Adam, thank you for what you do every day. And thank you for being a guest on the Chaos Whispers of Healthcare.
No, yeah. Thank you for having me. Yeah, it's good to see you, friend.
You
Long
too,
time
bud.
no. I love
All
you.
right. Thanks.
All right, bye.
Thanks for joining us on the Chaos Whispers of Healthcare. If today's episode resonated with you, please be sure to follow this podcast, rate, and leave a review on your favorite platform. I'm Dr. Megan Carter, and I will be back next week with more real talk, fresh strategies, and guests who are redefining what it means to lead with impact. Want to keep the conversation going? Be sure to connect with me on LinkedIn and download free tools and resources from my website. Both links are in the show notes. Let's heal this broken healthcare system together, one day at a time.